Hi, I'm Suzanne Pyles, and this is Demystifying Holistic Healing. In this podcast, I meet with holistic healthcare professionals to learn more about what they do and how they do it and what you need to know before you go, what to expect when you walk in the door. I want to give a special thanks to you, all of my listeners, to all of the guests who've taken time out of their day to be with us, and especially Tycoon Media Studio and their production team for bringing this whole podcast to life and making it all possible. So, super excited. Let's go. Hi, I'm Suzanne Pyles. Welcome to Demystifying Holistic Healing. I am very excited today because anyone who knows me knows my favorite doctor in the whole wide world is Dr. Sean, and I have him here with me today to talk about chiropractic care. So, Dr. Woods is a renowned chiropractor in Northern Virginia and much more. Throughout his career, he's focused on finding underlying causes of disease with intensive studies into nutrition and how our diets play a role in creating a healthy spine. He has also developed the Core Creator, which is an exercise roller with a specific shape. We're going to get into that later. And he is the author of The Healing Vibe. So we have Dr. Sean, your career has been focused on spine health and how it drives our overall health. So for this episode, you've done all sorts of things, but for this episode, we're going to focus on chiropractic care, which is my gateway drug into holistic healing and was the very first thing I did that was outside my comfort zone, and traditional insurance didn't cover it. It was a whole thing. But we'll get into that in a little bit. Dr. Sean, welcome.
Thank you for having me. This is my first podcast, so this is great.
My first podcast too. We're doing it together.
And I love talking about this stuff, so
yes.
It should be fun.
Yes. So can you kind of describe to us what exactly is chiropractic care and how did you get into it?
Well, those are two big questions. And so I'll start with the first one. Chiropractic care is basically adjusting spines, fixing bones that get stuck in the spine to release nerve flow to make the body heal. That's pretty much it. And that's a big, big, big concept because there's lots of ways to do that. The traditional cracking, like people hear, oh, you must crack bones all day. And I say, no, not necessarily. I don't crack bones all day. I can crack them, but I want to get the soft tissue healthy. I want to get the bones moving properly. And when chiropractic was founded, 200 years ago, not even 200 years ago, 150 years ago. And what happened was they were adjusting spines and they were making these huge healings. But this was a time in the 1890s where people were trying to figure out how to get healthy. This is when medicine was taking over, and they were using drugs to get people to heal, and people were using light energy and all types of energy. And chiropractic founded by getting the bones moving, opening up the nervous system, and people were healing dramatically.
Yeah.
So that's what chiropractic is, but it's changed to so many things these days because people do auto accidents, and then some people do what I do, and then some people do a whole nother technique of chiropractic. So it can get confusing because they're not all the same.
I didn't even know there were other types of chiropractic care. But, I go to you for everything.
Well, in school, let's say we learn 10 or 12 techniques of how to adjust spines. When you leave the school, generally you use several of those and you make your own practice. Some people just stay with one technique and they just do one technique and they don't mix with others.
That's what they learned in school and that's what they do.
Well, it's more systematic, where chiropractic is considered an art and a science and a philosophy. So every chiropractor is their own artist in a sense of how they want to unlock a spine.
Yeah, your wife is also a chiropractor.
Yes.
And she is very different. I've been to both of you, and she is very different in how she adjusts than you are.
Right. And we went to the same school, We went to the same clubs, like chiropractic clubs, to learn techniques, and she likes what she likes, and I like what I like.
Yeah.
And that's why when people ask me, like, my friend wants an adjustment in Kentucky, where's a Dr. Sean in Kentucky? And there's not.
Right.
What I tell people, though, is this is a good thing to understand. If you move to a town and you want a chiropractor, just start asking around, and the name will come to you who you should probably go to. You'll be like, oh, yeah, you need to see Dr. Joe. Dr.
And then
Joe's the best. And so,
everyone starts saying, you need to see Dr. Joe.
well, after 4 or
I won't
5
get
people
Dr.
say Dr.
Dr.
Joe,
Joe.
you're like, oh, I'm going to go check Dr. Joe, because he's probably, people are going back to him or her and getting results. That's why you hear the name. It's like self-advertising.
It's the same way you would go find a new hairdresser. You see someone and you say, you seem healthy.
Love your hair. Who does your hair? Right. Or who does your spine?
Who does your spine?
Right.
So what is it? I go to the chiropractor for everything. I go see Dr. Sean for absolutely everything. Everyone who knows me knows that. I'm like, oh, I woke up.
Right.
I woke up and I can't turn my head to the left. I go to Dr. Sean. I wake up and I'm like, my vision is blurry today. And I'm like, I could be getting older, but surely Dr. Sean can fix it. And I will come and see you because my vision's bothering me. And most of the time it's because there's something that's stuck in the back of my neck. And that affects your vision. Like your spine affects your whole body health. So no matter what I'm feeling, I know that my spine's going to play a role in it.
And well, you've been going like, what, 20 years to the chiropractor, to us? 20 years, 25 years?
Yeah. I was
right. So you kind of know this like the back of your hand, but as you get adjusted more, your chiropractor should be teaching you that you come in and say, oh, well, if you have a problem with your knee, I can help knees. I can help your cold. I can help your lungs, because the nerves that go to your muscles that make them hurt, well, the same nerves in a sense branch off and go to your organs and tell your organs how to function. So when you remove nerve interference, you're not just improving muscle tone, you're also changing the tone of the organs. And that's what chiropractic was really based on. So it's a huge philosophical thing, chiropractic. It's the most beautiful thing. It's called the Green Books. And D.D. Palmer was the inventor of chiropractic. And, his first adjustment, he had as a deaf man, and he adjusted them and he could hear again. And so it's just one of these interesting, ideas that, oh my God, you can change people's lives like that.
And instantly.
And so it's just a matter of going into the spine and unlocking it. And those bones get stuck in really patterned ways. Once you really start to do it, and you do it for many, many, many years, you see how spines fall into different patterns.
You would know if I was sleeping funny. I would walk in and I'm like, my shoulder's hurting me. And you're like, you're sleeping like this again, aren't you?
Right. And the reason why you'd know that is because I'm like, why would her bone be there and stuck like that? Like, what would she have to do? And you're like, well,
I woke up like this. And he was like, I know what you did.
Right. Right. So,
okay.
Yeah, it's it's just a huge ocean to jump in. And so if you just go to a chiropractor who just cracks your bones all the times and you don't get a lot of relief, you could say like chiropractic doesn't work. Or my friend went and he left and they were sore and they hurt and they didn't want to go back. So when I start adjusting people, you try not to do too much to people so that you don't want to scare them.
Yeah.
But you want to teach them. If you keep your spine healthy, you're going to last a long time. I mean, I tell you, if your spine is moving and your skull is moving, and your sacrum is moving, and you're pumping cerebral spinal fluid, and you have nerves going to all your organs, I was like, what's going to happen to you? Like, it's hard to have diseases when your spine's working really well.
Well, that's nice to know.
Yeah.
So one of the things that I'm hoping to do in this podcast is take the mystery out of what to expect when you go to a holistic practitioner. And so we're starting with Dr. Sean and chiropractic care. So for someone's first appointment, what should they expect to happen? Like, how does that work? Like, they come in, do they need to bring x-rays? Do they need to, like, what do they need to share with you? What should they expect when they come to you for the first time?
I'll just give you what happens in my office.
Perfect.
Because there's lots of different ways to do it. You can go and there's lots of, some people don't adjust on the first visit. They say never adjust someone on the first visit. Get their information, take x-rays, find out what's wrong with their spine, and then tell them you'll see them again in a week. And most times you're like, well, I'm hurt today. Can I get adjusted today? And sometimes people say no, but in my office, I take care of people the same day they come in. And they're just writing down basic information of their health history, what's going on with them. And
like you would in any other doctor.
Yeah.
You have a form to fill
basics.
that says.
Sometimes they just talk musculoskeletal stuff, and sometimes they're talking more organic stuff, like I have high blood pressure, or I have diabetes, or I have. And so with the musculoskeletal conditions, you don't have to talk long. You get some basic information. I do all the talking on the table. So within 10 or 15 minutes, usually of me meeting somebody, I have them on the table. And I'm like, okay, this is what's going on. And you teach as you adjust them the first time. And like I said, you try not to do too much. But if you get a couple SI joints moving, you get someone's upper back unlocked, and you get their neck and head moving, they're just like, I feel better. And then you just train them to come in once in a while, once a week. I never have people come in 3 times a week. Once a week, and then within 3 or 4 weeks, generally have most people on their way. And
yeah, I hope that people realize when you go to a chiropractor and they adjust your spine and you feel better right away, and you walk out the door, a few days later, things typically slip back into where they were, and you go back a few times to get it put back in place. And you're basically, the muscles are angry, so the muscles will pull it back out of alignment.
And there's a whole pattern,
right? And
in the patterns.
And if your back is out of alignment because you're sitting with your legs to the side and you're typing over here, and you do this every day, and you go to the chiropractor and you're like, oh, that feels better. But the next day, it hurt again, and I don't understand why. I don't think it's working. So it's not that the chiropractor isn't working. It's that your habits are
usually causing the problem.
Yeah. Oh my God. I remember I was in my 30s and I came into your office and I was wearing the highest heels and a 40-pound handbag over my shoulder. And I come clicking in and I was like, Dr. Sean, my back hurts. And he's like, well,
that's an easy one. You're like,
don't judge.
Have you not noticed that? Yeah. Right. Some of them are obvious and some of them are, can be really weird. Like, are you sitting and your knees flop to the side? You don't really know it. Or like you said, when you're sleeping. And that's where it gets into food. Food becomes the big thing that we'll talk about, in maybe our next
episode.
But when you don't digest food correctly, that's probably, in my experience, the most common reason my spine's misaligned is actually from organs spasming or malfunctioning. So then you have to teach them those things too. And that's why chiropractic can be not just about spines, but it can be about nutrition.
Yes.
It can be about supplements.
So I will follow up on what to expect on a first appointment. And as Dr. Sean said, not all chiropractors will adjust you on the first day. But if you're in pain and you are ready to be adjusted, make sure that you're dressed appropriately. Wear pants if you're a woman, something that's loose fitting, that makes it easy to move. You'll have to take your shoes off. Keep that in mind. So just some basic.
Yeah, loose fitting clothes, easy.
Yeah.
Some people, sometimes I tell them the more padding, the better. Should I take my sweatshirt off? Like, you may need it because I'm going to be digging at you and you may need the protection.
You don't need protection from Dr. Sean.
Right. But, going back to the technique thing, some chiropractors just crack bones and some people do a lot of soft tissue work, which a lot of people love.
Little massage and chiropractic at the same time.
Well, I guess you could call it massage, but when you're doing like deep...
You do not do that.
I'm not doing that. And I say that to people, you ever get a massage? They're like, oh yeah, I go, this is nothing like that.
It's not like that. Not with Dr. Sean.
Because when you're trigger pointing tissue and you're correcting soft tissue quickly, it hurts. It hurts to get into tissues and dig them in and get them to work again.
Think of it like, you know what, in that way it is a little bit like a massage. Because when you're getting a massage and they're working on a muscle, on a knot in a muscle, it doesn't feel good in the moment.
No.
When they're done, you're like, oh, that's better.
Right.
I think chiropractic care can be similar. There are times when you do adjustments and it doesn't hurt at all. And then there are other times when
it's super painful.
It's a little sore.
Right. That's
yeah.
Right.
And it just depends on what I've eaten.
See, she's very, very, very good, because you're exactly right. It all depends on what you've eaten. Because the same thing, like you say, well, did I turn and I go like that? I said, what did you eat? They're like, Dr. Sean, it has nothing to do with what I eat. I go, how was the Snickers bar? And they would go, how do you know it's a Snickers bar? I go, it just came into my head and I said it.
It's like, and I know you. I know you. I know what you did this morning. I know what you ate.
Well, it could be a million things. It could be a million things. But, the thing about getting a spine healthy is that the better your spine moves, it's a guarantee that your organs are working better.
Yeah.
It's a guarantee. Because very specific organs have very specific connections to vertebrae. So when a certain vertebra is out, like a T4 and a T5, I'm like, I know it's your gallbladder, and I know it's your stomach, and I know your liver's involved. I know it. If it was your bladder, your sacrum would be involved more. So the bones will misalign where the organ is connected to those nerves.
Right. And that's how you know where the inflammation and the body's out of alignment and out of adjustment. And that also helps you to say you're eating something that's too high in fat on a regular basis, and your body is showing the wear and tear from that. Or
the constriction that it causes.
Parties, Suzanne.
Right. It causes the tissues to contract, and then you got to go trigger point them all the time. Like, I'm always like, where's all this crap coming from in your shoulder? Because like a week ago, it wasn't there.
Right.
They're like, well, what have you been eating? And then you get into it, and then you figure out what it is, and you get off of that. And then the tissues start moving again, and then you don't need to keep beating them up.
Yeah.
And
so I want to tell a story about my first time at a chiropractor. So this is kind of aimed at anybody who feels like chiropractic care may not be for them because they've had back issues. So people say, oh, I can't go to the chiropractor because I have a slipped disc, or I have a vertebrae out of a crushed something. I don't know. Many, many reasons that I've heard people say they can't be seen by a chiropractor. And I was one of those people that used to say that as well. I had spine trauma as a small child, fell down the stairs, and had scar tissue along my spine that would get caught in between the vertebrae and would literally cause paralysis. And I was terrified that if I went to a chiropractor, that they were going to do something and I would be paralyzed forever. I was convinced. Child of the 70s.
I did not.
So, yes. So I, sometimes you get forced into things. So I was pregnant with my first child, and I had been in a car accident, and I couldn't take anything for the pain, and all the muscles in my whole body were tense. So I went and had a pregnancy massage done, where they had the special table, and she struggled to give me a massage because she said, you are so out of alignment. You need a chiropractor. And I was like, I'm pregnant and I can't go to a chiropractor. And she's like, yes, you can. And you need Dr. Cindy. And she sent me to a chiropractor, and I was in so much pain that I finally was like, fine, I will try anything at this point.
This is my sister-in-law.
Yes. So I went to your sister-in-law. That was my very first chiropractor. And I brought x-rays. I had my medical file. And I was like, I don't know if this will work because I'm a special case. And shut up.
All right, get on the table.
Sorry. And she was like, you know what? You're exactly the perfect candidate for chiropractic care. And she had, the table drop, so there was plenty of room for my big old belly. And I felt instantly better. And I was one of those cases where I had to go back a few times. I had never been in my life, and I had been out of alignment since I was 2. And I do have scar tissue along my spine, but it has not created a problem, knock on wood. It has not caused a problem ever since, and I have not taken muscle relaxers once. I've lived on muscle relaxers and painkillers. Like, I lost probably at least 1 week of sick days a year for the excruciating back pain that I had suffered all the way up until I was pregnant.
Mostly lower back or neck?
Finally, it was mostly lower back, and my leg would just give out. Like, I wouldn't be able to walk, and I would have to, like, we could be out doing stuff, and all of a sudden my leg would give out, and I was like, I have to go. Like, someone's got to go get me, go get the car. I can't walk. Like, it was weird, and it was hard. There was a time when I was really little. I was like 7, and I woke up completely paralyzed. I couldn't move at all. So I suffered a lot, and I can't tell you how much of an impact chiropractic care has had on my life. And I want to scream it from the rooftops. And as I said, if you know me, you know Dr. Sean, just by hearing me talk about him. So,
well, a cool thing to add real quick is that the technique she did on you with the blocks was called SOT, which is sacral occipital technique.
Oh, I didn't tell you guys that. So she didn't do a rough adjustment.
Right, so there was no rough adjustment, and she really just sat on the blocks and let her pelvic girdle reset.
Yeah.
And I'm sure she did some soft tissue work and dug at you a little bit, and then you just needed a little resetting of the SI joints. So that was the technique.
She put these little, like, I just laid flat, which you don't get to do very often when you're pregnant because you can't lay on your belly. And the table gave out so that there was, like, it was fabulous. And then she took these little foam wedges and just tucked them here and there until my spine was completely aligned and I felt weightless, and it was beautiful. So,
very cool.
Yeah, I highly recommend chiropractic care. I can't recommend Dr. Sean and his office enough. And we will put their contact information in the notes of this podcast if you want to reach out. And thanks for joining.
Thank you.
Thanks so much for watching. Thanks to my guest for being here. And please let us know in the comments if there's anything else that you guys want to hear about.